The American Civil War will be remembered for the highest number of amputations and some of the most horrific wounds ever recorded in the history of warfare. This war found itself exactly between two eras, creating a deadly combination of advanced weaponry, outdated medicine, and military tactics of warfare, which would take a huge number of lives and leave thousands of people with lifelong physical and psychological consequences. Of course, for those who were lucky enough to survive this hell. Soldiers on these battlefields faced injuries that were more brutal than ever before, limbs torn apart, faces disfigured, and bodies riddled with bullets. This era's warfare was characterized by a dangerous mix of technologically advanced weaponry and obsolete battle tactics, a recipe for devastation on an unprecedented scale. The introduction of the rifled musket and the mini-ball completely changed the nature of war injuries. These bullets, with their enhanced range and accuracy, could effortlessly smash through bone and tissue, leaving behind devastating injuries. The severity of these wounds was such that even the most experienced surgeons of the time were often left hopeless. However, the horror of these wounds wasn't solely due to the advanced weaponry. The medical knowledge and practices of the era were painfully inadequate. Surgeons, overwhelmed by the sheer volume of casualties, frequently resorted to amputations, which were often performed without any form of anesthesia, leaving soldiers in unimaginable pain. The lack of understanding of infections and hygiene further compounded the crisis, as even survivable injuries could quickly become lethal due to infection. The onset of the American Civil War marked a significant turning point in military armament, introducing weapons that were drastically different and more deadly than those used in previous conflicts. The adoption of rifled muskets and mini-balls, which replaced the less efficient smoothbore muskets and round lead balls, had a direct and brutal effect on the soldiers in battle. Rifled muskets, equipped with grooved barrels, offered a significant improvement in both range and accuracy. This advancement meant that soldiers could target enemies from greater distances, changing the dynamics of battlefield engagement. The mini-ball, a seemingly unassuming piece of ammunition, played a pivotal role in changing the face of warfare during the American Civil War. Its design and function were revolutionary for its time, making it far more destructive than any previous infantry bullet. The mini-ball, a conical bullet made of soft lead, was designed to expand upon firing, allowing it to fit tightly into the rifling of the musket barrel. This tight fit, combined with the bullet's aerodynamic shape, greatly increased the lethal effectiveness of the musket. The difference in being hit by ammunition from these new weapons compared to the older types was stark and horrifying. Whereas previously, a soldier might sustain a relatively clean wound from a round lead ball, the mini-ball caused catastrophic injuries. Upon impact, it would deform, causing extensive damage as it tore through flesh and shattered bone. Such injuries were often so severe that they necessitated amputation, as there was no hope of the wound healing on its own. Moreover, the rifled musket's greater range and accuracy meant that soldiers were vulnerable to being hit from distances previously considered safe. This change not only increased the number of casualties, but also amplified the fear and psychological strain among the troops. During the American Civil War, many of the battle tactics employed were deeply rooted in Napoleonic principles, a style of warfare that had been developed decades earlier and was ill-suited for the era's advanced weaponry. Napoleonic-style tactics primarily involved large groups of soldiers, often in tight formations, moving together across the battlefield. These formations, typically in lines or columns, were designed for the age of smoothbore muskets, where massed volleys of fire were essential for effective combat. The theory was that by concentrating the soldiers' firepower, they could overwhelm the enemy through sheer force. These tactics also facilitated easier control and movement of large numbers of troops, which was crucial in the pre-radio era of warfare. However, these traditional formations proved catastrophic in the face of the Civil War's advanced weaponry. Rifled muskets, with their greater range and accuracy, could decimate these tightly packed lines of soldiers long before they came close enough to engage the enemy effectively. This mismatch led to appalling losses, as soldiers were cut down in droves while advancing across open fields. The persistence in using these outdated tactics resulted in battles often being turned into bloodbaths. The treatment and care of wounded soldiers during the Civil War were harrowing experiences, both for the injured and for the medical personnel. These experiences, however, played a crucial role in advancing medical practices later. When a soldier was wounded on the battlefield, immediate treatment was often rudimentary and performed under dire conditions. The primary goal was to stabilize the injured and transport them to field hospitals, which were typically makeshift facilities set up near battle zones. These hospitals were often overcrowded and understaffed, with surgeons and nurses working tirelessly to care for the flood of casualties. Field hospitals during the Civil War were far from the sanitized environments we associate with medical care today. They were hastily assembled in tents, barns, or other available structures, lacking in both hygiene and basic medical supplies. Surgeons performed amputations and other surgeries in rapid succession, often without proper anesthesia, leading to excruciating procedures. The risk of infection was high, as medical knowledge about sterilization and germ theory was not yet fully developed. Amputation became a common and often necessary procedure due to the nature of battlefield injuries. The mini-ball, with its devastating impact on the human body, frequently left soldiers with wounds so severe that the only way to save their lives was to remove the affected limb. The process of amputation at that time was basic and brutal. Surgeons, working under the constraints of time and limited resources, performed these surgeries quickly. They would cut through skin and muscle, then saw through the bone, often without proper anesthetics. Soldiers would bite on a bullet or a piece of leather to endure the pain. Anesthesia was still in its experimental stages, often leading to the use of alcohol as a rudimentary pain reliever. However, due to frequent shortages, even this meager comfort was available only in limited quantities, leaving many soldiers to endure surgeries and treatments in excruciating pain. This horrifying but necessary procedure was the only hope for many to avoid fatal infections like gangrene. The Civil War introduced the triage system, a method that necessitated quick and often heart-wrenching decisions by medical personnel about the order in which soldiers were treated. Faced with an overwhelming number of casualties, surgeons had to rapidly assess each soldier's condition, determining who required immediate attention, who could wait, and, most tragically, who was beyond help. This system, born out of necessity in the face of limited resources and time, forced medical staff to make pragmatic yet difficult decisions, often leaving those with slim chances of survival to receive minimal or no treatment. As the Civil War progressed, the nature of combat evolved dramatically, shifting away from traditional, organized warfare to more chaotic and primitive methods. This shift was partly due to the inadequacies in command and the lack of trained personnel, which led to a brutal and disorganized style of fighting, particularly notable in close-quarter engagements. Hand-to-hand combat became increasingly common as battles descended into chaos. The orderly firing lines of the past gave way to frenzied melees, where soldiers, often out of ammunition or too close to effectively use their firearms, resorted to more primal forms of fighting. Bayonets, sabers, and even bare fists were used as soldiers clashed in desperate struggles for survival. The brutality of these engagements was unlike anything seen in earlier conflicts. Commanding large masses of not well-trained soldiers posed significant challenges during the war. Many of the troops were volunteers or conscripts with little to no prior military training. This lack of experience, coupled with the chaotic nature of the battlefields, made it difficult for commanders to maintain order and discipline. As a result, battles often devolved into uncontrolled skirmishes, with units fragmenting and soldiers fighting independently or in small groups. In the times of the Civil War, the concept of PTSD as we understand it today was unrecognized. The mental trauma experienced by soldiers was often oversimplified and misunderstood. Known then as soldier's heart or nostalgia, these terms now seem inadequate to describe the profound psychological effects of war. Soldiers returning from the battlefield frequently exhibited symptoms we would now associate with PTSD, nightmares, anxiety, depression, and flashbacks. However, the medical community of that era lacked the knowledge and resources to properly diagnose or treat these symptoms. Treatment methods were rudimentary and often ineffective. In some cases, soldiers were given rest or time away from the front lines as a form of recovery. The American Civil War, a conflict marked by bloodshed and suffering, was also a period of significant learning and transformation. The lessons learned during this tumultuous time had far-reaching impacts, shaping future military tactics, medical practices, and societal perspectives. In terms of military technology and tactics, the Civil War acted as a catalyst for change. It highlighted the deadly effectiveness of new weaponry and the need for evolving battlefield strategies. The use of rifled muskets, mini-balls, and improved artillery demonstrated the increased lethality of modern armaments, prompting a re-evaluation of traditional combat formations and techniques. The medical field, too, underwent a profound transformation due to the challenges faced during the war. Faced with unprecedented numbers of casualties and severe injuries, medical practitioners were forced to innovate. This era saw significant advancements in surgical techniques, particularly in trauma surgery and amputation methods. The importance of sanitation and hygiene, spurred by the high incidence of infections and diseases in field hospitals, led to improved medical practices that would benefit future generations. Beyond the immediate realm of warfare, the Civil War's lessons permeated society. The scale of the conflict and its aftermath shaped national attitudes towards veterans and their care, particularly those who had suffered serious injuries or mental trauma. In conclusion, the American Civil War was a period of profound learning and change. The lessons it taught, through the harsh realities of its battlefields and hospitals, significantly influenced the course of future military engagements, medical practices, and societal attitudes towards war and its veterans.